I'm gonna tell you 10 things you need to know about fibroid embolization, which is an easier and less invasive way to take care of fibroids. If you never heard of it, don't worry, I will break down to you and explain in detail. What are fibroids? First, let's talk about fibroids. These are totally benign tumors that can develop in the uterus, and they're actually pretty common. About 70% of women have fibroids by the age of 50. It is important to remember they are not cancer, and they will not turn into cancer, but they can cause problems. What are the symptoms? Some women may not even know they have fibroids. Others can experience symptoms like heavy periods, pain, pressure, and frequent urination. Some fibroids can be so large that they can reach the same size of a 20-week, 25-week, or even a full pregnancy. Fibroids can grow really fast, especially in the perimenopausal period. But after the menopause, they tend to shrink to a really small size. You need to know the treatment options for fibroids, which include hormonal treatments such as birth control pills, which can slow down the bleeding, or even Lupron, which can shut down your whole hormonal system like the menopause. If these are not good options for you, then you have surgeries such as hysterectomy when they remove the whole uterus, or myomectomy when they just remove the fibroids. What is fibroid embolization? Now let's get into fibroid embolization, also called uterine fibroid embolization or FE. It's a minimally invasive procedure where an interventional radiologist like me uses imaging to guide tiny particles the size of little grains of sand into the blood vessels that are feeding the fibroids. These particles will then decrease the blood flow, which causes the fibroids to shrink. How is the procedure done? Well, we insert a tiny tube the size of a thin spaghetti called a catheter to a tiny puncture site in the wrist or the groin areas. Then, using imaging like X-rays, we then guide this catheter into the little blood vessels going to the fibroids. Once we're in the right spot, then we release those tiny beads we talked about to decrease the blood flow. What are the benefits of the embolization? Why should you choose embolization rather than surgery? The great thing about fibroid embolization is that it is minimally invasive. That means no major surgery, fewer risks, no scars, and faster recovery time. Many women are able to go home the same day or the day after the procedure, and the recovery time is usually just a few days up to a week. So who can benefit from this procedure? Fibroid embolization is a great option for women who want to treat their fibroids without undergoing major surgery. It is especially helpful for those who want to keep their uterus intact, whether for future pregnancy or just for personal preferences. What to expect after the procedure? Well, after the procedure, most women experience cramping and discomfort for a few days. The cramping can be severe the first day or so, but pain relief medications can help manage that. You will likely need a little bit of rest, but most women are back to their normal activities within a week. Over the next few months, then the fibroid will continue to shrink, meaning symptoms like heavy bleeding or pelvic pain will improve. How effective is fibroid embolization? It really depends on the symptoms and the imaging appearance. However, on average, 90% of women who undergo this procedure have resolution of their symptoms and are happy with the outcome. It is not 100% like the hysterectomy, but it's pretty good considering it's much less invasive. What are the downsides and potential complications of the uterine fibroid embolization? The main downside of the procedure is the post-embolization syndrome. You see, many women experience flu-like symptoms after the procedure. This can include fever, pain, nausea, and fatigue. These symptoms usually last a few days up to a week and can be managed with pain medications and rest. A heat pad is also very helpful. Real complications are really rare with this procedure, but they include ovarian failure, meaning getting to the menopause earlier than anticipated, or infection, which is also really rare, but could require antibiotic treatment, or in severe cases, another procedure such as a DNC. Can women get pregnant after embolization? Well, many women have conceived after fibroid embolization, so it is possible. The odds are certainly better than with a hysterectomy, where the chances are essentially zero. However, there is some concern about the uterine blood flow after the embolization, and if your main goal is getting pregnant, we usually prefer to try other options like myomectomy first. But it is always a case-by-case basis, and you should discuss with your interventional radiologist and with your general doctor. So if you or somebody else you know is dealing with fibroids, fibroid embolization could be a great alternative to hysterectomy. It's a safe and effective way to treat the fibroids without major surgery. So here's a typical case of a fibroid embolization. A catheter is initially inserted in the right groin and advanced to the left uterine artery guided by X-rays. Here's a picture showing the left uterine artery, and a microcatheter, which is a tiny catheter, is advanced in the left uterine artery. And this is a picture showing the very vascular fibroids. We then inject these tiny beads that we talked about to slow down the blood flow to the fibroids. And this is a final picture showing significant decrease in the blood flow to the fibroids, so they cannot survive. We then advance the same catheter in the other side. Again, we find the uterine artery and advance a tiny microcatheter in the right uterine artery. We then take a picture. In this case, the left was feeding most of the fibroids, but we also embolize the right uterine artery.